You about the pathogenesis, if I am right. We spoke of pathogenesis and then we also spoke of characteristic symptoms. Okay. Can we have a quick recall of what was done?
Starting with pathophysiology.
Okay.
It's more of hemolysis, that is destruction of
Very good.
then action on the skin causes ganglion
Okay.
process, carbuncle.
Good. Okay. So what we did was we started with pathogenesis, and this, as your friend rightly says, is more of a hemotoxin. So the affinity for blood is very much prominent in CROTALUS. Okay. And of course we also spoke of ailments done, and not only blood, it also has an affinity for liver, pneumogastric nerve, GI. Through pneumogastric nerve it affects the GI. Okay. Anyway, see if you have clarity, probably if I remember this was the last slide of last class. So to have a small continuity, this is where we had stopped in the last class. Okay. So what do you see here is, you see more of hemorrhages, and the hemorrhages, as mentioned, hemorrhage can be from any orifice. Okay. There is no specific area from which you can see bleeding in CROTALUS. Any part it can start bleeding, and the character of bleeding is what you saw here, is more dark, passive, non-coagulable, slow, thin fluid and highly offensive. Okay. So this is what we saw, and it is also used to absorb clot in the eye. Okay. That a very important remedy. Which is the other remedy which has a capacity to absorb clots? Arnica. Arnica also has an affinity for the capillaries. Okay. Acting on the capillaries, it can absorb small clots. Very important in arnica, and it has been clinically verified. Okay. So we'll go ahead and we'll look at the other characteristic symptoms of CROTALUS. There's something very characteristic related to tongue. Homeopathy, we have different constitutions with different characteristic tongues. Now, what is the character of tongue you have in this particular remedy? The tongue which is, yeah, don't use blood everywhere. The tongue which is chocolate, strawberry. Okay. Red tongue. Which are the other remedies? Fiery red tongue. Which is the remedy? Fiery red tongue. Tongue. Good. Apis mellifica. Okay. Apis mellifica. So you have tongue which is red. And then again, a very important remedy for menopausal affections. CROTALUS is a very good remedy for menopausal complaints. Quickly, as a PG student, other remedies that come to your mind when we talk of menopause? Very good, amyl nitrosum. What is it that you have in amyl nitrosum? You have more of hot flushes, and they want cold. Good, amyl nitrosum. A rare remedy though, it's important. Apart from amyl nitrosum, lacasis, calcarea ars. What happens in calcarea ars? Palpitations in menopausal women, in obese women. Calcarea ars, lacasis, sulfur, sepia, sanguinaria. Good, sanguinaria. Rare remedies we never think of in menopause. One more such remedy that we don't think of is graphites. Okay. Graphite is sulfur itself. These are few remedies that we can think of in menopausal syndrome. And each of those remedies will have their own characteristic indications. Okay. Just because somebody comes to us with menopause, we can't randomly prescribe any of those remedies. You will have the symptoms of the patient which you need to match with the remedy, and then you need to prescribe. Okay. So in today's class we will just try to understand what are those symptoms you have in Crotalus that will be useful for you in future to prescribe in menopausal affections? Okay, like for example, you have hot flashes, a common symptom, nausea, empty feeling in stomach, palpitations, increased sweating, clammy sweat and fainting. These are few symptoms, which we see in Crotalus horridus. Okay. So going ahead, there's something very interesting in Crotalus related to vomiting. Can any one of you think what is it that is so characteristic in Crotalus when it comes to vomiting? Huh? Simple, something that you can share here is vomiting could be of blood. Why vomiting could be of blood? Hematemesis. Why? It's a very good remedy for cancer. We'll discuss that a little later. But what is that PQRS you have is, okay, the moment they lie on the right side, they have to vomit. What is it? The moment they lie on the right hand side, they have to vomit. If they lie on the right hand side, they feel better. Which is the remedy? The only remedy? Very good, antim-tart. Antim-tart is exactly opposite to Crotalus horridus. In Crotalus horridus, if they lie on to the right hand side, they have to vomit. In antimonium tart, okay, right side is the only position they feel better. Any other position in antim-tart, they have to vomit. So this is the small clarity you need to have. So Crotalus horridus, lying on right hand side, vomiting, lying on right hand side. The only remedy is Crotalus horridus. Okay. And we are talking of this ophidia, okay, which has more of cancerous affections. And those cancerous affections where you will be seeing more of blood. Okay, like for example, we just saw that it can be a very good remedy for CA stomach. Okay, and it can also be a very good remedy for CA liver. Okay, psychosyphilitic remedy having a tendency for cancer, CA stomach, CA liver, CA tongue, CA bladder, CA uterus, any CA. But the important indication is the CA will be associated with lot of bleeding. CA will be associated with lot of bleeding. Okay. Not only bleeding, you will also have bad weakness. Now this is the indication of Crotalus horridus in cancer. Okay. So if you look little more in detail, I have taken this from one of very good author, Dr. Fatak's Materia Medica, and he says tissues rapidly decompose, producing putrid and malignant conditions. So very good remedy for malignancy. Okay. So cancer, hemorrhages, vomiting, and again going back to its action on the blood. Not only hemorrhages, Crotalus horridus is capable of causing a very important condition. And what is that condition? Septicemia. Septicemia. Okay. So which other remedies can you think of for septicemia? Very good, pyrogenum. Yes. Huh? Okay, muriatic acid. Ignitia. Not ignitia. Echinacea. E. Echinacea, not ignitia. Echinacea. Your friend was talking of muriatic acid and you are talking of pyrogenum. Good. Any other remedies that you can think of? Good. No, it's there. Don't hesitate. Bacteria. Okay. Bacteria. Bacteria and muriatic acid mainly in typhoid. Done? Okay. And pyrogenum could be any other conditions where you see septicemia. Wherever there is sepsis, septic abortion, septic fever, you can think of pyrogenum, very important remedy. So here again you have septicemia, fine, and septicemia which can be because of suppurative tonsillitis. Septicemia could be because of abscess, it could be because of boils, ulcers, gangrene of the throat, or septicemia could be a result of fever. So these are few conditions in Crotulus which can give rise to septic conditions. Okay? Septic conditions. Done? You also have lesser known remedies like streptococcin for septic conditions, and that will be more specific when the septicemia is happening because of a streptococcal infection. Though it is not homeopathic, okay, but do remember streptococcin can be a very important remedy for septicemia, and it has its own symptoms. If those symptoms match, you can prescribe streptococcin homeopathically. Okay, so we will look at the other characteristic symptoms. What is this image trying to tell you? It's a simple image. Yeah, side affinity of Crotulus. Okay. Now, we all know lachesis is a left-sided remedy. One of the ophidias, which is predominantly right-sided, is Crotulus horridus. You have more of right-sided affections in Crotulus. Okay. So I would like to share a small case here. A very peculiar case of one of our homeopath's mother. She had come to clinic with vertigo. Now when I use peculiar, what was the symptom that we saw in this lady was, she said, doctor, vertigo, only my left half of the head is is having vertigo. Sorry, right half. Left is absolutely fine. Here I don't feel vertigo. Vertigo I feel only on the right half, right side. Okay. See, luckily the advantage of repertory, when you go into repertory, you open the chapter vertigo, side only right. One remedy that is mentioned is Crotulus horridus. Okay. So without any second thought, I had prescribed her Crotulus with very good improvement. Okay, with very good improvement. So Crotulus, vertigo, only right half. Crotulus, don't miss this. See, I was fortunate to get this remedy. I was fortunate to get this symptom. Okay, and that's what I've been trying to tell you time and again. These symptoms are all there, and that's the beauty of homeopathy. They're proved on human beings, and we are treating human beings, and we'll get all the symptoms that are there. Okay, so never I expected that there can be vertigo only of one half, and luckily it was right side, and luckily repertory mentions a remedy, and that remedy is Crotulus, and this lady beautifully improves after Crotulus. Okay, so right-sided affections. Ophidia having predominantly right-sided affections is Crotulus horridus. Now we'll look at the desires. What is it Crotulus mainly likes? Crotulus, they like more of pork. They like more of sweet. Okay, and they like more of alcohol, stimulants. Many ophidias had the same desire for stimulants. Desires stimulants, desires sweets, and desires pork. Okay, these are few things. And though we were talking of Crotulus being a hemotoxin, I also told you Crotulus has little amount of neurotoxin also. So what you see here is, you see that it's a very important remedy for convulsions. Convulsions with trembling of limbs, there is froth coming from the mouth, patient cries very violently and patient will be in a delirious state. Okay, so this is what the source books give under the heading convulsions in Crotulus horridus. Okay, now a symptom pertaining to the rectum. Okay, you will mainly see diarrhea. Okay, diarrhea which is black, thin, coffee ground and offensive. This is the character of stools you will have in Crotulus horridus. Okay, now hope I am clear with the characteristic symptoms. Before we talk of mind, which I will take another 10-15 minutes, and we'll try to finish the Crotulus horridus snake. So what did we discuss? We discussed about the characteristic symptoms. I was trying to give you mainly the physical characters. Okay, and under that we saw hemorrhages, and we also spoke of convulsions, we spoke of diarrhea, we spoke of septicemia, we spoke of desires. Okay, what else did we speak? We also spoke of tongue, and then menopausal complaints. These are few things, and cancerous affections, very very important in Crotulus. Okay, now a very important topic we'll be trying to discuss, a topic of Crotulus. Okay, now when you look at the mind of Crotulus, what is it that you have in Crotulus? Crotulus is already done for you in your UG. So what are all the mind symptoms you remember in Crotulus? What are all the mind symptoms?
They are loquacious like lachesis, but they differ in. Lachesis will speak whatever comes to.
Very good. Good.
They are little
Okay. Yeah. See, Brahmaramba, she's got a point. She is trying to explain the loquacity of Crotulus. Good. I appreciate. Anything else? See, like Ophidius, Crotulus is also loquacious. We'll try to understand a little while later how Crotulus is different from lachesis when it comes to loquacity. Good. Loquacity. What else? What else do you have?
They fight more with the family.
Okay, they are quarrelsome. Good. Okay, they are quarrelsome. Anything else that you can recall from your UG classes, or you could have used in your practice, or you would have studied for your exams from some source? Can you recall mentals of Crotulus? Okay, so I'll keep it very simple. Next 10-15 minutes, we'll try to look at 4 areas. Okay, we'll be trying to look at the mind of Crotulus under the heading will, intellect and memory, emotions and morals. 4 headings, so that you remember better. See, when you look at the will, okay, generally what we have seen in Ophidia, will, what are the headings we have? We have 2 things under will. What is it? Weak will and strong will. Simple. Okay, there might be better classification, but for today's class we'll keep it simple. Will could be big, will could be strong. Now, is Crotulus a weak willed guy or a strong willed guy? Okay. See, we saw this under the mind of Ophidius. Majority of the Ophidius are weak willed. Okay, they are very timid. So the same thing you see in Crotulus, like many Ophidius, they are very timid and they also have a desire to escape. So will, they are basically weak-willed constitutions. So moving ahead, when you look at the intellect part, I was looking through the repertory. You have rubrics like they are very ambitious. Done? And they are very competitive people. Very ambitious, very competitive, and people with good business acumen. People with good business acumen. So this is what you have under the intellect. Okay. See, when you look under the memory, majority of the ophidias, especially if you look at lachesis, they all have very active memory. They all have very active memory. They can give you the events, past events, very clearly, with dates, the situations. Unfortunately, in CROTALUS, there are issues with memory. Okay, they forget well-known states. They forget the word while speaking. Well-known states they forget. Okay, and they forget words while speaking. And they also have issues with memory. Weak memory, I just told you. Memory weakness mainly for dates. Memory weakness mainly for names, for words and persons. Memory weakness for dates, names, words and persons. Okay, this is important. So now when they have a memory like this, what do you think will happen in the next level? Imagine a patient, imagine a child having issues with all this. So what generally happens is they tend to make mistakes. Very good. They tend to make, I'm happy you are connecting to the series of things happening. Okay. So they tend to make mistakes. So what are all the mistakes they make? They make mistakes in speaking. They make mistakes in writing. They also make mistakes in spelling. Or you saw that they forget the word, so they tend to use wrong words. So these are few things mentioned under your repertory. Okay, which I have tried to pick it up. Okay. So this is with will, intellect. What are we left with? We are left with emotions and emotions, understanding and morals. Okay. See, when you look at the morals, again going back to Ophidias, what are the morals you have in Ophidia? Ophidia generally have bad morals. Okay. They are very, very manipulative. Okay. They manipulate you. They are non-conscientious. Then they can tell lies. Okay. So CROTALUS also can be very manipulative. People with bad morals, they can be manipulative. Now the last heading of today is, we'll be discussing the emotions of CROTALUS. How are they emotionally? So any quick inputs? Dr. Bhamarama was talking of loquacity. Good. One thing is they are loquacious. Agreed. Like any snake, they are loquacious. Then what else? See, basically, if you look at CROTALUS, there is anxiety, they are irritable, they are angry. Okay. They also have a lot of fears. It's a timid constitution, so you tend to see a lot of fears. Few fears that I mentioned for you for today's class is their fear of evil, fear of failure and fear of misfortune. Okay? These are few fears they have. Going ahead, you also see that CROTALUS is a very sad person, very sentimental person, and a person like any other Ophidia is very suspicious. They might suspect the doctor, they might suspect the system itself. They may not believe in homeopathy, they may not believe in our medicines. Okay. I mean, one of the remedy could be CROTALUS, or one of the remedy could be Ophidia. Okay. So sadness, sentimental, suspicious, and coming to the loquacity. If you just read Kent's Materia Medica, the lecture on Crotulus, he beautifully explains how Crotulus is different from Ophidia, the other Ophidias, mainly Lachesis. Lachesis is also loquacious, Crotulus is also loquacious, but the difference is Lachesis can talk on any topic. Dr. Kent says if you are in a room and if you have a Lachesis person, he will not allow anybody to complete or anybody to conclude. He will jump in between, okay, and whether he knows or not, he will try to conclude. That is the character of loquacity you have in Lachesis. But Crotulus is not as loquacious as Lachesis. Okay, he tries to talk, but he might fumble, he might stammer in between. He is not very confident when it comes to talking, the way how Lachesis is. Lachesis can talk with ease. Okay, that ease, that comfort is what is missing in Crotulus horridus. Okay, so even under your repertory, under loquacity, Crotulus is not highlighted as Lachesis. Okay, so loquacity, and this is a very important feature of Crotulus, especially in the syphilitic stage. Okay, in the syphilitic stage, what you see is there is a lot of indifference. They are not caring, they are not bothering. The indifference can also go to the extent of aversion to family members, or certain people, certain persons, they might have a strong aversion. They might have a strong aversion. Okay, so this is related to the mind symptoms of Crotulus. So we'll quickly sum up what we have done. Characteristic symptoms we have already summed up a little while ago. So we'll look at the mind. So we try to understand the mind under 4 very important headings. The first one was will, and under will what we saw is Crotulus is a weak-willed person, he is timid and he has the desire to escape. Okay, and under intellect we saw that they are very competent, they are very, very ambitious, and constitutions who have good business acumen. Okay, that's what we also saw. And third, what we saw was the memory part. What was the memory like? Weak memory, mainly for dates, names, okay, roads, streets, fine, and the exact impact or the direct impact of this memory is reflected on he making mistakes. Okay, and what we also saw is morally not a very great guy. He can be manipulative. Any snake for that matter, they can be very, very manipulative. Okay, and last was the emotional part. From anxiety, from irritability, we saw how their journey goes into indifference, the syphilitic thing. Okay, these are all solid things: anxious, irritability, anger, fear, sadness. They are more of psychotic. And this slide or this thing is mainly the syphilitic emotions of Crotulus horridus. Okay. Any questions related to Crotulus? Done? Okay. So what we will do in the next class is we'll start with another Ophidia. Which are all the other Ophidias in your syllabus? Elaps, you have Elaps? Okay. Elaps, Naja is there, both rows. And of course Lachesis. Okay. So one of these Ophidias we'll try to explore. Hopefully Elaps or bathrobes, because we have not heard much about these snakes. So we'll try to explore them in detail. And must be, if time permits, I'll also try to differentiate between Crotulus and Lachesis. Fine? We'll go in a very systematic method and we'll try to differentiate both the remedies. Let me finish Lachesis. Once I am done with Lachesis, then you can also contribute in differentiating these two Ophidias. Okay? Done? Any quick questions? All of you clear? Chalo, thank you.